Pain has a quiet way of reshaping daily life, slowly narrowing the space in which we move, think, and feel at ease. For many people over 50, persistent lower back discomfort becomes an accepted companion, something to tolerate rather than question. Yet this acceptance often masks a deeper misunderstanding of how the body works. The spine is not a fragile column destined to deteriorate with age. It is a living structure designed for adaptability, supported by an intricate network of muscles, nerves, and joints that thrive on intelligent movement. When pain lingers, it is often not a sign of irreversible damage, but a signal that communication within this system has weakened, particularly around the lumbosacral joint, where the spine meets the pelvis and movement transitions into stability. This region serves as the body's central hinge, transferring force between the upper and lower halves with every step, bend, and twist. Its health determines how smoothly we move and how safely we carry load. Over time, prolonged sitting, reduced activity, and habitual postures place continuous strain on this junction. Muscles that should provide subtle stabilization gradually fall silent, while larger muscles attempt to compensate, creating patterns of tension and fatigue. The result is stiffness, restricted movement, and persistent discomfort that can feel mysterious and discouraging. Yet beneath this discomfort lies an opportunity for restoration, rooted in the body's remarkable capacity for relearning. Intentional movement gently unlocks the spine and hips, restoring natural mobility that has been lost to habit and fear. Slow pelvic tilts, controlled spinal waves, and mindful hip rotations invite fluidity back into tissues that have grown rigid. These movements stimulate circulation to areas that often receive limited blood flow, nourishing discs, ligaments, and surrounding muscles. As circulation improves, tissues become warmer, more elastic, and better able to absorb stress. This internal environment encourages healing, reducing inflammatory signals and easing pain sensitivity. Equally important is the role of sensory feedback. The joints and muscles of the lower back are rich with receptors that inform the brain about position and movement. When mobility decreases, these receptors provide less accurate information, and the brain responds by tightening surrounding muscles to protect the area. This protective tension, while well-intentioned, perpetuates stiffness and discomfort. Gentle mobility exercises restore sensory clarity, allowing the brain to perceive the spine more accurately. As awareness improves, unnecessary tension melts away, and movement becomes smoother and more confident. Unlocking the spine also has profound effects on posture. When the hips and lower back regain mobility, the entire body realigns. The pelvis returns to a more neutral position, reducing excessive curvature in the lumbar spine. The ribcage stacks more naturally above the pelvis, and the head balances effortlessly over the shoulders. This alignment reduces compressive forces on spinal joints and discs, easing mechanical stress that contributes to pain. Over time, standing and sitting become less demanding, conserving energy and promoting comfort throughout the day. These changes extend beyond the physical. Chronic pain often reshapes emotional experience, fostering frustration, anxiety, and a sense of helplessness. When movement begins to feel easier, hope returns. Each small gain in mobility becomes a reminder of the body's adaptability. This psychological shift is not trivial. It alters how individuals approach daily life. Activities once avoided are reintroduced cautiously, then confidently. The world expands again, replacing limitation with possibility. Scientific research increasingly supports this approach. Studies show that gentle, controlled movement improves joint lubrication, enhances neuromuscular coordination, and reduces chronic inflammation. The nervous system becomes more responsive, reaction times improve, and muscular efficiency increases. These physiological changes create a positive feedback loop. Improved movement reduces pain, and reduced pain encourages further movement. Over time, this cycle fosters resilience, allowing the body to withstand everyday demands with greater ease. Perhaps most importantly, intentional spinal mobility restores a sense of agency. Instead of viewing pain as an external force beyond control, individuals begin to recognize their ability to influence how they feel through simple, mindful actions. This realization is empowering. It transforms exercise from obligation into self-care, from burden into ritual. Each movement becomes an opportunity to listen inwardly, to respond compassionately, and to nurture well-being from within. As the spine unlocks and mobility returns, the body rediscovers its natural rhythm. Movement flows rather than resists. Breathing deepens, circulation improves, and energy stabilizes. The lower back, once a source of persistent discomfort, becomes a foundation of support and balance. In this gentle reclamation of motion, individuals reconnect with their bodies, rediscovering confidence, comfort, and a renewed sense of possibility that extends far beyond physical relief. Activating deep stabilizing muscles in the lower back is one of the most overlooked yet powerful strategies for reducing chronic pain and restoring mobility in adults over 50. These muscles, particularly the multifidus, do not generate large movements like the glutes or quadriceps, but their role is subtle and essential. They act as the body's internal stabilizers, providing continuous micro-adjustments that maintain alignment, distribute forces evenly across the spine, and protect joints from strain. When these muscles weaken or become inactive, the spine loses its natural support system. Larger muscles then compensate, often overworking and creating patterns of tension that exacerbate discomfort. This imbalance is not simply a mechanical problem, it is a neurological one, reflecting the gradual loss of connection between the brain and the body's stabilizing systems. In many cases, traditional back exercises focus on stretching or superficial strengthening without addressing the deep layers of muscular support. Stretching alone can provide temporary relief, but it does not teach the nervous system how to recruit stabilizing muscles at the right time. Strengthening exercises for larger muscles, while beneficial for overall mobility, do not guarantee that the small stabilizers will activate efficiently during daily activities. What is required is intentional, precise movement that retrains these muscles to respond reflexively whenever the spine and pelvis move. This is the foundation of true functional stability, a state in which the spine is supported from within, reducing pain and improving control over motion. The process of reactivating deep stabilizers begins with awareness. Individuals are encouraged to sense subtle movements in the lower back and pelvis, learning to engage muscles that are often dormant. This might involve gentle tilts, small spinal waves, or slow controlled shifts in posture that challenge the muscles to stabilize without generating large movement. The key is control, not intensity. By focusing on the quality of activation rather than the quantity of repetitions, the nervous system begins to relearn the proper sequencing of muscle engagement. Over time, these micro-adjustments become automatic, restoring a natural balance between stability and mobility. Neurological retraining is equally important. Chronic back pain can alter the way the brain perceives the lower spine, creating protective patterns that limit motion. The nervous system, seeking to prevent further discomfort, may inhibit the deep stabilizers while over-recruiting superficial muscles. Intentional exercises help reverse this protective inhibition by providing clear, safe signals to the brain that movement is secure. Each controlled repetition reinforces proper recruitment patterns, gradually restoring confidence and fluidity. This process illustrates the intimate connection between mind and body. The brain does not simply command the muscles, it learns from feedback, adapting its control strategies in response to consistent, intentional practice. Reactivating deep, stabilizing muscles also enhances the body's resilience to everyday demands. Activities such as bending to pick up objects, rising from a chair, walking on uneven surfaces, or carrying groceries rely on these muscles to maintain alignment and protect the spine. When stabilizers function correctly, forces are distributed evenly, reducing excessive pressure on discs, ligaments, and joints. This not only prevents flare-ups of pain, but also minimizes the risk of future injuries. Over time, daily movements become smoother, posture improves naturally, and energy is conserved because the body operates more efficiently. From a physiological perspective, engaging the deep muscles improves local circulation and nutrient delivery to spinal tissues. These muscles envelop the vertebrae, providing subtle support and facilitating micro-movement that nourishes discs and ligaments. Improved circulation helps maintain tissue health, reduces stiffness, and encourages recovery from minor inflammation. It also supports joint lubrication and flexibility, allowing the spine to move with greater ease. In this way, The act of reactivation addresses both the neurological and structural contributors to chronic lower back pain. Psychologically, reactivating deep stabilizers fosters a sense of control and empowerment. Chronic pain can create a persistent fear of movement, leading to avoidance, stiffness, and reduced quality of life. By learning to engage these muscles safely, individuals regain trust in their bodies. Confidence replaces hesitation. Movements that once felt risky now feel manageable. This renewed trust extends beyond exercise, influencing everyday activity and encouraging a more active, fulfilling lifestyle. The interplay between physical capability and emotional assurance highlights how deeply interconnected the body and mind are in maintaining health and independence. Consistency is crucial in this process. Small, deliberate exercises performed daily or several times per week yield cumulative effects. Each session strengthens neural pathways, reinforces muscle recruitment, and deepens body awareness. The changes are gradual but profound. The spine becomes more stable, postural alignment improves, and discomfort diminishes. The deep stabilizing muscles, once dormant, reassert their protective function, quietly supporting movement and preventing the recurrence of pain. Over time, this foundation of internal support allows larger muscles to work more efficiently, creating a harmonious system in which strength, flexibility, and stability coexist naturally. Ultimately, activating deep stabilizers transforms not only the physical experience of the lower back, but the entire approach to aging and movement. It emphasizes control over brute force, precision over intensity, and awareness over repetition. This approach respects the body's inherent intelligence, fostering resilience, confidence, and freedom of motion. By reestablishing connection between the brain, nervous system, and deep muscles, individuals over 50 can reclaim mobility, reduce discomfort, and restore the capacity to move with ease and assurance, making every step bend and lift safer, more comfortable, and more empowering. Balance is often taken for granted until it falters. Yet it is one of the most intricate and essential systems in the human body, particularly as we age. What appears to be a simple ability to stand upright, walk steadily, or turn without hesitation is, in reality, a continuous dialogue between the brain, the sensory organs, and the muscular system. Tiny receptors embedded in the muscles, joints, inner ears, and feet are constantly sending information to the central nervous system about the body's position in space. The brain integrates these signals and issues precise, rapid commands to muscles throughout the body to maintain stability. This complex coordination is largely automatic in youth, but with advancing age, it becomes less precise, slower, and more prone to error, leading to instability, hesitation, and in some cases, falls that can significantly impact quality of life. As the body ages, several factors contribute to the decline of balance. Sensory receptors in the feet, ankles, and joints may lose sensitivity, diminishing the quality of feedback sent to the brain. Vestibular function in the inner ear, which detects orientation and motion, can become less acute. Visual cues that aid spatial awareness may also weaken. Combined, these subtle changes create a situation in which the nervous system no longer has a complete picture of body position, and corrective adjustments may be delayed or insufficient. Even small disturbances, such as stepping onto an uneven surface or shifting weight to reach for an object, can become challenging. Walking, though beneficial for cardiovascular health, provides limited stimulus to the full balance system because it is largely predictable and repetitive, rarely challenging the complex interactions between the sensory and motor systems. Fortunately, the balance system is remarkably adaptable. Even in later decades, targeted exercises can retrain the nervous system to interpret sensory input more accurately and respond more effectively. Simple, controlled movements that challenge stability encourage the brain to re-engage with the body, refining motor responses and enhancing postural control. Exercises might include shifting weight from one foot to the other, standing on one leg for brief periods, or performing slow turns and rotations while maintaining core engagement. Each of these activities stimulates proprioception, the body's awareness of position and movement, and strengthens the pathways between sensory input and muscular response. Over time, this training restores confidence, coordination, and fluidity in movement. The benefits of balance training extend far beyond the legs and feet. The core muscles surrounding the spine and pelvis are essential for maintaining upright posture and distributing forces efficiently. When these muscles are engaged during controlled balance exercises, they provide a stable foundation for the entire body, reducing compensatory tension in other areas and enhancing overall movement efficiency. Strengthening these stabilizers improves not only posture, but also the body's ability to absorb stress from daily activities, reducing the risk of injury. Even small improvements in core engagement can transform how a person rises from a chair, navigates stairs, or bends to lift objects, making everyday life safer and more comfortable. Balance is not solely a physical skill. It has profound psychological implications. Chronic instability or fear of falling can create anxiety and lead to avoidance behaviors, which in turn reduce mobility and exacerbate weakness. Training the balance system gradually reintroduces controlled challenges, allowing individuals to confront these fears safely and rebuild trust in their bodies. Each successful attempt reinforces the perception that movement is safe, leading to a positive feedback loop where confidence enhances performance and performance enhances confidence. This interplay between body and mind demonstrates how deeply interconnected physical function and psychological well-being are, particularly in older adults. The nervous system also benefits from the cognitive engagement required in balance exercises. Maintaining stability while performing controlled movements challenges attention, spatial awareness, and coordination, which stimulates brain regions associated with executive function and sensory integration. In this sense, balance training is not only a physical intervention, but also a cognitive one. The brain remains actively involved in learning and adjusting, reinforcing neuroplasticity even in later life. This dual benefit, enhancing both physical and mental function, is a key reason why balance-focused exercises have such a broad impact on overall quality of life. Consistency is critical. Like any skill, balance improves through repeated intentional practice. Even short daily sessions can produce significant long-term results, strengthening the musculoskeletal system, enhancing neurological control, and fostering confidence in movement. As proficiency increases, individuals find that previously challenging activities, walking on uneven terrain, turning quickly, reaching for objects become manageable, fluid, and comfortable. Stability becomes less about rigid control and more about dynamic adaptability, where the body responds to changes in the environment efficiently and safely. Ultimately, balance training restores a sense of independence and freedom. It allows individuals to move confidently, without hesitation, reducing the risk of falls and increasing participation in daily activities. Each controlled movement becomes an opportunity to reinforce the brain-body connection, to nurture stability, and to cultivate awareness. The cumulative effect transforms not only the body's capacity to maintain equilibrium, but also the way individuals perceive their own physical capabilities, encouraging greater engagement with life, improved emotional resilience, and a renewed sense of control over the aging process. Through this careful attention to the subtleties of movement, balance becomes a foundation for safety, confidence, and enduring vitality. Joint stability is one of the most critical, yet underappreciated components of maintaining mobility and independence as we age. Our joints are not simply hinges or pivots. They're dynamic structures that rely on a finely tuned interplay of muscles, tendons, ligaments, cartilage, and the nervous system. Each joint is designed to allow smooth movement while simultaneously providing stability and protection from excessive forces. With age, however, this balance gradually diminishes. As muscles weaken, connective tissues lose elasticity, and circulation to joint surfaces decreases. Even small daily movements, if performed without attention, can create uneven pressure on joints, contributing to stiffness, discomfort, and the subtle loss of functional mobility that often goes unnoticed until it affects quality of life. The hips, knees, and spine are particularly vulnerable because they bear the brunt of weight-bearing activities. When stabilizing muscles weaken, joints absorb forces they were not meant to handle alone. Microstrains accumulate in cartilage and connective tissue, initiating low-grade inflammation that can persist over months or years. This inflammation reduces range of motion, increases pain sensitivity, and alters movement patterns. The body compensates by recruiting other muscles, often leading to overuse injuries, imbalances, and postural misalignments. These changes are rarely obvious at first, but over time they manifest as the stiffness, discomfort, and instability that many adults over 50 experience. Targeted exercises designed to enhance joint stability address these issues at their source. Unlike general strength training, which often focuses on large, visible muscles, joint stabilization exercises activate smaller, deeper muscles that provide continuous support around the joint. These muscles act like internal scaffolding, absorbing stress, guiding motion, protecting cartilage and ligaments from excessive strain. As these stabilizers strengthen, the body can distribute forces more efficiently, reducing mechanical stress and decreasing the likelihood of injury. Even subtle improvements in joint support have a cascading effect on posture, movement quality, and overall physical resilience. Joint stability is also intimately connected to neuromuscular coordination. Proprioceptive receptors located in muscles, tendons, and ligaments continuously inform the brain about joint position and movement. With age, this feedback becomes less precise, and corrective adjustments are slower, increasing the risk of imbalance or misalignment. Intentional exercises that challenge stability improve this sensory feedback loop. Controlled weight shifts, gentle rotational movements, and mindful engagement of stabilizing muscles help the nervous system recalibrate, allowing joints to respond dynamically to changes in position and load. Over time, this enhances both automatic and conscious movement, improving confidence and control during everyday activities. Maintaining joint stability has significant implications for postural alignment. Poor alignment places uneven forces across joint surfaces, accelerating wear and tear and leading to further instability. Strengthening stabilizing muscles encourages proper posture, allowing the pelvis, spine, and shoulders to align more naturally. As the alignment improves, movement becomes more efficient, energy is conserved, and the risk of discomfort or injury decreases. Simple daily tasks, such as bending, reaching, or climbing stairs, feel smoother and less taxing, reinforcing independence and overall quality of life. The benefits of joint stability extend to tissue health as well. Controlled movement and muscle engagement promote circulation, enhance nutrient delivery to cartilage, and stimulate synovial fluid production, which lubricates joints and supports flexibility. Cartilage, which lacks a direct blood supply, relies on movement for nourishment. Without adequate stimulation, it can gradually degrade, leading to stiffness and reduced mobility. Stabilization exercises help maintain cartilage health and joint elasticity, allowing for sustained function even in later decades. Joint-focused exercise also influences inflammation and tissue recovery. Low-grade chronic inflammation is common with aging and contributes to pain and decreased mobility. Regular mindful movement improves circulation and lymphatic flow, encouraging the removal of metabolic waste and reducing inflammatory signals. This creates an internal environment conducive to tissue repair and regeneration, as the body becomes more resilient, capable of withstanding daily stresses with less discomfort. Psychologically, improving joint stability fosters confidence and reduces fear of movement. Chronic joint discomfort often leads to cautious, restricted movement, which in turn exacerbates weakness and instability. Stabilization exercises rebuild trust in the body by creating a reliable foundation for motion. Individuals gain the assurance that they can move safely, which encourages more active engagement with daily life, reduces anxiety about pain, and supports a sense of independence. Over time, consistent practice of joint stability exercises transforms the way the body moves. Muscles work in harmony rather than in compensation. Posture improves naturally. As movements that once felt restricted become fluid and controlled. The risk of falls or injuries decreases, and energy is conserved because motion becomes more efficient. The body learns to support itself from within, creating a foundation of resilience that extends to strength, balance, and overall physical function. Ultimately, joint stability is more than a physical attribute. It is a cornerstone of independence, confidence, and quality of life. By strengthening stabilizing muscles, enhancing neuromuscular coordination, and improving proprioception, adults over 50 can restore the natural harmony of their bodies. Movements become safer, more efficient, and less painful. Daily life becomes an opportunity to move freely rather than cautiously, and the body gains the capacity to adapt gracefully to new challenges. Through intentional focus on stability, the joints reclaim their ability to support movement, protect the spine and extremities, and allow individuals to age with strength, balance, and confidence. Perhaps the most profound benefit of addressing chronic lower back pain through intentional, mindful movement lies not only in the physical changes but in the transformation of perception, confidence, and overall well-being. Pain often instills a subtle, yet pervasive fear or hesitation that affects every motion. Individuals over 50 who have lived with persistent discomfort frequently develop guarded movement patterns, limiting the range of motion in their hips, spine, and core. They may bend cautiously, avoid certain postures, or favor one side of the body over another, slowly creating imbalances and compensations that perpetuate discomfort. This protective response, while understandable, gradually diminishes both physical capability and the sense of bodily autonomy, replacing curiosity and fluidity with tension and hesitation. Addressing this aspect of chronic pain requires more than stretching or general exercise. It demands a deliberate reconnection with the body, a retraining of both the muscles and the nervous system to move without fear. Rebuilding confidence and movement begins with small, intentional actions that challenge old protective patterns in a safe, controlled environment. Exercises designed for this purpose focus on gentle spinal mobility, controlled hip shifts, and activation of deep stabilizing muscles that have been dormant or underused for years. Each repetition, performed with attention and awareness, communicates to the nervous system that motion is safe and manageable. This communication is crucial because chronic pain does not only reside in muscles or joints, it is reinforced in the brain. Over time, fear and discomfort become intertwined with movement itself, creating a feedback loop where anticipation of pain restricts motion, which then exacerbates weakness, stiffness, and tension. By consciously engaging muscles in safe, deliberate patterns, this loop is gradually broken, and movement begins to feel less threatening. The nervous system is remarkably plastic even in later decades. When guided through controlled exercises, it relearns the relationship between motion and safety. The deep spinal stabilizers, including muscles such as the multifidus, are reactivated, sending constant microadjustments to maintain alignment. This internal support reduces strain on larger muscles and connective tissues, allowing movement to become fluid and efficient. The brain begins to perceive the spine not as a fragile structure at risk, but as a capable, responsive system capable of adapting to a range of motion. As these neural pathways strengthen, fear diminishes and confidence grows, creating a positive cycle that reinforces both physical stability and mental assurance. Physical changes alone, while significant, do not fully capture the transformation that occurs when fear is addressed. Psychological resilience emerges as individuals regain trust in their bodies. Tasks that once felt daunting, reaching overhead, bending to lift objects, turning quickly become manageable. The restored sense of control encourages more engagement in daily life, reducing sedentary behavior and promoting overall health. This renewed confidence is not superficial bravado. It is a quiet, internal assurance born from repeated evidence that the body can move safely and effectively. The act of moving without hesitation becomes a form of empowerment, reshaping how individuals experience their own aging bodies. The mind-body connection is further strengthened by the mindful quality of these exercises. Each motion is performed with attention to alignment, breath, and the subtle engagement of stabilizing muscles. This mindfulness fosters interoception, or the awareness of internal bodily states, allowing individuals to detect early signs of fatigue, tension, or imbalance. Rather than pushing through discomfort blindly, they learn to respond intelligently, adjusting posture or movement to maintain stability. This heightened awareness not only prevents injury but cultivates a deeper understanding and respect for the body, encouraging a more compassionate and informed approach to self-care. As this practice continues over weeks and months, cumulative benefits emerge. The spine becomes more flexible, hips regain mobility, and the core muscles provide consistent internal support. Daily activities, from walking on uneven surfaces to rising from a chair or bending to pick up objects, feel smoother and more controlled. Pain, once a dominant feature of movement, begins to recede, not through avoidance, but through functional restoration. Energy levels improve as movement becomes more efficient, and posture naturally aligns with less effort. The body, once constrained by fear, gradually operates with a renewed sense of freedom and ease. Social and emotional well-being also benefit from this regained confidence. Individuals who move without hesitation are more likely to engage in social activities, pursue hobbies, and participate in community life. They carry themselves with a sense of self-assuredness that positively impacts relationships and overall mood. Chronic pain no longer dictates behavior or limits interaction, and a sense of independence is restored. Movement, once associated with caution and risk, becomes a source of pleasure, accomplishment, and agency. Ultimately, the transformation is holistic. The integration of physical restoration, nervous system retraining, and psychological empowerment reshapes the experience of aging and chronic discomfort. Strength, flexibility, and stability are reclaimed, but more importantly, so is confidence and trust in the body's capacity to adapt and respond. Each small intentional movement contributes not only to pain reduction, but to a broader sense of self-accusi, resilience, and vitality. This approach demonstrates that even in the presence of persistent discomfort, adults over 50 can regain control over their bodies, restore freedom of motion, and move through daily life with assurance, ease, and a renewed sense of independence.